related to the Nevada Battle-Born State Plans and the Market Stabilization Program. Joining me today in presenting will be Michael Gordon, the Division's Waiver and Stakeholder Director, and our Division Administrator, Stacy Weeks. Also, I just wanted to say thank you so much for being here with us today. As we go through the presentation for the state's 1332 waiver application, you will note that we have a set time frame of 30 days for formal public comments. You will also have an opportunity to provide public comments today during the meeting, but we just ask that you please hold all comments or questions until the public comment portion of the presentation. And with that, we'll go ahead and get started. We could go to the slide 2, please. So the division will be hosting two of these tribal consultations to engage you all on the state's 1332 waiver application. One of those is today, and the second one, I don't have the date in front of me, I apologize, but it will be here shortly. And I just wanted to note that per state law, the state's 1332 waiver application must be submitted to the federal government for approval no later than January 1st of 2024. This waiver seeks federal approval for Nevada to receive savings to the federal government from Nevada's implementation of a new state contracted health insurance option and a reinsurance program to both establish and finance a market stabilization program. Today, we will be providing an overview of the Battle-Born State Plans and the Market Stabilization Program, provide an opportunity for questions and public comment, and then give an overview of the next steps in the state's waiver application process. Next slide, please. The same state law requiring Nevada to submit the 1332 waiver application also requires the Director of the Department of Health and Human Services to contract with health carriers to offer new health insurance options. These options will be referred to as Battle-Born State Plans, or BBSPs. These new health insurance options of the BBSPs must be available to consumers who shop for health insurance in the state's health insurance exchange, otherwise known as the Nevada Health Link, beginning January 1st of 2026. The Battle-Born State Plan options will, for the most part, mirror other plans in the Nevada Health Link, with one exception. The BBSPs must meet an annual premium reduction target and pay their provider networks rates that are at or above Medicare rates. With that, I'll hand it off to Michael Gordon to give an overview of the Market Stabilization Program.
Okay, good morning, all. Thank you, Melinda. And to continue on what Melinda was just saying on the overview, the second key initiative is a Market Stabilization Program. The waiver proposes to use federal savings from the BBSPs to finance this program. Some of the key goals in that are to, 1, mitigate the potential risk of the new premium reduction targets on health carriers and the provider networks. 2, to reward health carriers and the provider networks if they improve health outcomes and quality of care. And 3, to ensure market stability in Nevada's individual health insurance market with the introduction of the new health insurance option and reforms. Continuing on, to achieve these goals, the governor has outlined 3 new initiatives. 1, a state-based reinsurance program at no cost to the state that is aimed at alleviating any unexpected financial risk to participating carriers and the provider networks and introduction of the BBSPs. 2, a quality incentive payment program to reward high-performing health carriers and the provider networks. And 3, Practice in Nevada program to provide incentive for more providers to live and practice in Nevada, and especially in rural regions of the state. These programs, if approved, would begin in plan year 2027 after the state receives its first year of federal savings under the waiver from plan year 2026. The BBSP statutory requirements are as follows. State law requires the director to contract with health carriers to offer the new Battle-Born State Plans and use the director's Medicaid contracting authority to enforce certain state requirements. Participating carriers must offer these new plans to the Nevada Health Link and meet all federal and state standards for qualified health plans under the Affordable Care Act.
Michael, I'm sorry, it's Monica. I think I may have lost you. Which slide should I be on? I apologize.
Oh, I'm Sorry,
no,
you're on
I-
slide 6. Sorry. That's my fault. Okay, sorry about that. So participating carriers must offer these new plans to the Nevada Health Link and meet all federal and state standards for qualified health plans under the Affordable Care Act. Offer at least one silver and one gold battle-born state plan. Offer plans that will meet certain premium reduction targets, which will increase gradually to at least 15% over the first 4 years, and pay provider rates that are no lower than Medicare rates. And with that, I will hand it over to our administrator, Stacy Weeks.
Good morning. So just to walk through the new procurement process that will be underway with the new public option plans, or what we're calling the battle-born state plans. So under state law, the director must establish a new procurement process. This procurement process will be aligned with our Medicaid managed care program. And this essentially will create new contracts with carriers in the individual market that also offer Medicaid managed care plans. This procurement must take place at the same time as the state's next Medicaid managed care procurement, which is slated for at least the RFP will be released no later than January 1, 2025. Any health carrier seeking to participate in the state's Medicaid managed care program must submit a good faith bid under state law to also contract with the state to offer and administer the new battle-born state plans. The division will use the contract with the carriers as its enforcement tool for the statutory requirements for the battle-born state plans. Currently, the division contracts with 4 major health carriers for its Medicaid managed care program: Anthem, Health Plan of Nevada, which is United Health Group, Silver Summit, which is Centene, and Molina. Next slide, please. So this slide just sort of gives you an overview of how these new battle-born state plans compare to other individual market plans. So again, when we think about the individual market, we're talking about the non-group market, which means these are folks that are shopping for their own health insurance. They don't have employer coverage. They're not on Medicaid. These are folks that go and look for coverage and have to buy it on the market, either directly from a carrier or on the exchange. So on the far left, you'll see the first group is what we offer today in the state's non-group plan in the individual market. These are the requirements that all carriers must meet if they're offering products to people who shop for their own health insurance. They have to meet state network adequacy requirements. They have to have solvency standards that they've met. They have to go through a state premium rate review with our Department of Insurance, as well as being available directly from the carrier. And there are other standards in state law that they must meet. Now, if a non-group plan wants to be offered also on our exchange, which is what we call the qualified health plan, our exchange rules also apply. These include ACA standards, essential benefits, the 10, I think most of you might know, there's 10 essential benefits they have to provide. There's also certain consumer protections for products that are sold through our exchange, the Nevada Health Link. They also have to be certified by the exchange and the federal government that they've met all of these requirements. They also have to pay a carrier fee for each of their products to the exchange, which finances the exchange. They also have to be put together in a way that they meet certain metal tiers. So for example, there's a bronze plan, there's a silver plan, a gold plan, and a platinum plan. And really these are all distinguished by the cost that that the consumer must pay. For example, your bronze plan is going to be your cheapest premium, but maybe have the higher deductibles, right? And on the platinum side, it's going to be the higher premium and the lower deductibles. So we're asking, these in the exchange, all the carriers to offer their plans in these metal tier categories. And then standard plans in the exchange also have to have on the outside be purchased from the carrier through the exchange. Now the BBBSPs, the battle-born state plans, they have to meet all of those requirements, all the non-group plan requirements, as well as to be a qualified health plan and be offered on our exchange. But there are other requirements that are added to these plans through state law and our new contracts with the carriers. For example, we have to meet the premium reduction target in state law, which is at least 15% over the first 4 years, as compared to the previous year of the product, so in 2024. Minimum provider rate floor. So for example, they cannot pay their providers lower than the Medicare rates. So in negotiations, there is a floor. They also have to have their other contract requirements that we may include, like quality metrics, network adequacy standards that we want to make sure are maybe above and beyond what's in the individual market, as well as silver and gold tiers. So they have to at least offer a silver plan and a gold plan in the exchange. And again, they have to be available for purchase on the exchange as well as off the exchange. Next slide, please. So there are a couple of other requirements that we wanted to mention that go along with this new product being offered in 2026. So a provider, and starting in January 1, 2026, if a provider is under contract with the state as a network provider in any of the other state contracted health insurance programs like Medicaid, Public Employee Benefit Plan, the state's workers' comp plan, they must also participate as an in-network provider in at least one network with the state's contracted battle-born state plan. So in other words, if a provider is in network for a public employee benefit plan and Medicaid, they must also be in network for at least one of our carriers that offer the battle-born plan. These providers must also apply certain policies to accept new patients enrolled in the battle-born plan to the same extent as the provider accepts new patients not enrolled in a battle-born state plan. This essentially is trying to avoid discrimination based on the fact that they're covered and they get their insurance through a battle-born state plan. State law also requires our director to promote in its contracting process strategies with health carriers that will better align networks between Medicaid and the marketplace, address health disparities in the individual market, improve cultural competency in our provider workforce, and increase the use of value-based payment models with providers, as well as addressing the gaps in Nevada's healthcare workforce. Next slide, please. So right now, to implement all of this work, we have to seek a 1332 waiver application. That's why we're here today, to get feedback on this waiver. We also had to do under federal law an actuarial study and make sure it met certain requirements under federal law. The 1332 waiver, according to the actuarial study, is expected to lower premiums and generate savings for the federal government due to lower premium tax credits. This is due to both the premium reduction target as well as the new reinsurance program that's going to be part of this application. So Nevada can bring home all these savings to the federal government and fund other state programs if approved as part of this waiver. And the finding right at this point is that Milliman, our actuary, estimates that the 1332 waiver and all of the, essentially the premium reduction target with reinsurance, will achieve an estimated savings of $279 million in federal savings, again, which we can recapture in the first 5 years, an additional $760 million at the end of the first 10 years. And as you can see in the process, we are at number 3 of 7. We are currently in the public workshop process and will be submitting in January 1 of 2024. Next slide, please. Michael, I think I'll turn it back over to you. Thank you.
Yes, thank you. Okay, so now I wanted to talk about how this impacts tribal communities. So the mandated premium reduction will reduce premiums for consumers purchasing battle-born state plans, which includes consumers who are American Indian and Alaska Natives. According to the 2023 Open Enrollment Public Use File, there were 516 AI and AN members enrolled in coverage to the Nevada Health Link in 2023. The battle-born state plan program does not impact existing protections available to American Indians and Alaska Natives through the Nevada Health Link. So AI and ANs who earn less than the 300% of the federal poverty level will remain exempt from cost sharing and qualifying for premium tax credits. The modified adjusted gross income calculations for the population will continue to exclude some revenue earned on reservations from federal trust payments. And the population may still change QHPs once a month without worrying about enrollment dates. Next slide, please. Okay. So the battle-born state plans will not impact existing financial assistance provided under the Division of Healthcare Financing and Policy, in which AIs and ANs eligible for Medicaid do not pay premiums and do not have any other cost sharing. The battle-born plans will not impact healthcare service providers through IHS, tribal or urban Indian health programs. The BBSPs do require more robust and aligned networks with Medicaid, including essential community providers. As a reminder, qualified health plans, which will include the battle-born plans, must include at least 35% of available essential community providers in each plan service area in the provider network, and must offer contracts in good faith to all Indian health service providers. Participating health carriers are also required to pay tribal providers participating in the plans networks no lower than what they pay in Medicare. And with that, I will hand it back over to Melinda.
Thank you, Michael. All right, I would like to open up for public comment or questions at this time. If you are joining via the Teams platform, if you could please use the raise hand feature, and we'll go in that order. Or if you're calling in, I don't know if we have any callers, but you may press *5 to raise your hand. So just want to open it up for public comment or questions or anything you would like.
Melinda, I don't see any questions or comments.
All right, thank you, Monica. Okay, we will move on to outlining the next steps in this process. So with that, I will, oh, actually, you know what? I just did want to go over this slide really quickly. So we do have 30 days from November 20th to December 20th for the public comment period on this program and this application. You may submit your public comments through the website noted here, or you can email comments to 1332, so 1332 waiver program at dhcfp.nv.gov, and we can drop that email in the chat as well. So you do have those areas to submit your public comment or questions on this, and I think the next slide is about next steps. Nope.
That was the next steps. You got it.
Okay. Okay, good. All right, and then I just want to hand it over to Stacy for any closing comments on the presentation. Thanks.
Thanks, Melinda. So if anyone has any final thoughts or have questions, you can email us. You can also email our waiver inbox. It's on the agenda. If you have formal public comment. And again, thank you for attending. I think we have one person, I see, Andrew. But if you have follow-up questions or just want to submit formal written comments, we are definitely taking those for the next 30 days. So thank you. That's it.
Thank you, everybody.
Okay, thank you.
Thank you
Have a
so
good
much.
day.
Thank you.
Thanks. Bye.
Bye-bye.